We're excited to bring you information all about COVID-19 vaccine and the local distribution plan. Tonight we'll begin with a brief Santa Barbara County vaccine update, followed by questions and answer session with pre-selected questions from community members. Community leaders involved in the question gathering process have been invited to ask their questions here tonight. Our panelists today include Dr. Von Del Reynoso, Director for the Santa Barbara County Public Health Department, Dr. Henning Onsorg, Health Officer for Santa Barbara County, and Paige Batson, Deputy Director for Community Health. I'll now turn it over to Public Health Director, Dr. Von Del Reynoso.
Thank you, Jackie. So this slide describes our current distribution plan of vaccines in our community. Vaccines flow to our community first. It first starts with the federal government. The federal government allocates vaccines directly to pharmacies in a partnership to vaccinate long-term care facilities. The federal government also allocates directly to the state of California. In a few weeks, the state of California will be asking Blue Shield of California to do the vaccine allocations to both the county public health department as well as our healthcare providers. So together with our healthcare providers, the public health department will be vaccinating all of Santa Barbara County. I'd like to share a little bit about the order of vaccine priority. Right now, we are vaccinating frontline healthcare workers with direct patient care. We are also vaccinating persons aged 75 and older. Because we have limited allocation from the state each week, roughly about 6,000 doses each week for first doses. Frontline healthcare workers with direct patient care are more likely to be infected and thus must be prioritized so that we can ensure high quality patient care. Persons aged 75 and older are faced with higher mortality rates, so they are also being prioritized. We anticipate that very quickly, we will begin vaccinating persons aged 65 and older. In addition, within several weeks, we anticipate vaccinating those at risk of exposure at work in the following sectors: education, childcare, emergency services, food, grocery, agricultural workers. So things are changing quickly. I have heard about worries when the public will be vaccinated. I want to reassure you that we are ready to vaccinate our public, our community members. The issue is the limited number of vaccines that we are getting from the state. In addition to that, current data show that we as a county have put 81% of the vaccines that we have been given into arms of community members, and that is a really good rate. So again, because of the limited number of vaccines being sent to California and from Sacramento to us in Santa Barbara County, we are limited in how quickly we can distribute vaccines to the general public. And this vaccine shortage is not only happening in Santa Barbara County, but it is statewide, nationally, and internationally. I'd like to talk a little bit about the role of public health. The role of public health really is to provide the safety net population with the needed care. So what does this mean? This means that the safety net are community members who are homeless, who may be undocumented, who may be struggling with mental health or substance use, or others who are underserved. And how we do that is by power building relationships, power building partnerships. We currently have several initiatives with community leaders and organizations to address health equity issues. The purpose of these initiatives is to address issues and barriers to health. So during this pandemic, our efforts to ensure an equitable access is occurring to testing, isolation and quarantine, wraparound services for home isolation and quarantine, and now vaccine. We work together with our community partners to ensure that this is happening. And I'd like to point out that tonight's town hall is a product of one of our initiatives in our power building partnerships. In addition, we in public health are focused at removing barriers. That means removing barriers to access to vaccination sites, removing barriers to access to information. And we hope that in partnership with our community providers, that we will improve in all of these areas. We also want to acknowledge to the communities that have been underserved that trust may be an issue, that we seek to build trust with all of our community members. This is the beginning of the conversation, and this is the beginning of what we are doing to address it. And so my hope is that moving forward and working with community members, we can engender trust, we can build confidence in working together. What happens after this town hall? We can only move at the speed of trust. So in order to achieve equity, we need solutions that not only remove barriers, but are fundamentally considerate of the community's unique history and needs. We are, as a public health department, committed to health equity. And what that means with regards to vaccines is exploring with our communities the environments that is most comfortable and most convenient for community members to access the vaccine. It is really by working together, by partnering together, that we will be a healthier community and we can advance together. Thank you.
Thank you, Dr. Del Reynoso. And thank you for everyone who's joined us today. We've already reached our limit on Zoom. And so I invite anyone who is trying to access the town hall to visit our County of Santa Barbara Facebook page and our Santa Barbara County Public Health Department Facebook page. You can access the live stream there. So please encourage your neighbors who weren't able to make it into the Zoom to watch us on those channels. We'll now transition to the question portion of our town hall, and I'd like to welcome Dr. Andrea Medina, Coordinator for the Latinx Indigenous COVID-19 Response Task Force. Dr. Medina will talk about how the questions being posed tonight were selected, and she'll also introduce those asking the questions. Dr. Medina?
Thank you, Jackie. Deseo comenzar honrando el territorio.
I wish to acknowledge the Chumash territory by those that live here in the Santa Barbara County. I also offer a deep apology to our brothers and sisters Chumash, whose absence in this space is a result of a long history of a lack of support and attention, both by the federal and local government, by also the community members. What we do see is still the lack of adequate, equitable medical services, among other basic needs of the Chumash people. Honoring that we are currently living during a time of great loss and pain, we join the call, the solidarity call of the original people so that their needs and concerns become a priority. In these times where racism, xenophobia, white supremacy, and all systems of oppression are mixed with the effects of the pandemic that's happening in the lives of everyone, the work of Latinx and indigenous migrants in response to COVID-19, we want to open healing spaces which are inclusive and collaborative with the members of our community. This event is the first take of what could be a health equity approach where the concerns and needs of the Black, African American, and Asian, Indigenous, and Latino community, as well as the LGBTQA community and people with special needs, can be seen each other, listen to each other, and support each other in common unity. As coordinator of this working group, I sincerely thank the members of these communities who have given their time and commitment to make this event possible and give answers to concerns that are affecting our people. Right now, they're not asking us to hug. We do feel a healthy closeness through a true union of health equity, where we want to invite the voices of the Chumash community. I feel honored and grateful, and I want to introduce members of the community who will ask questions, asking questions to the panel.
I would like to introduce now Paola Ligario, Indigenous Youth Organizer with the Mixteco Indígena Community Organizing Project, MICUP.
Hola a todos, la pregunta que tiene la comunidad es
Hi, the question that is, how long is immunity with the vaccine? And that's everything. Thank you.
Thank you. Because this vaccine is so new, it was just invented, we do not know yet how long this immunity will last. When we compare it to other vaccines and see how good the response is with the antibodies in the blood of people who got it a year ago, we anticipate that it lasts at least 1 year or hopefully 3 years, at which time we would need a booster shot.
Thank you. I would like to now introduce Lawanda Lyons Pruitt. She's our community partner and president of the Santa Maria and Lompoc National Association for the Advancement of Colored People, NAACP.
Good evening. My question is 3 parts. The first question was the vaccine tested on Black, brown, and indigenous people with high blood pressure? Part 2, how about with diabetes? And then my third part of the question is, if so, what were the results?
Thank you for that question. And yes, both of these products, the one from the company Pfizer, as well as the other one from the company Moderna, were tested on a variety of ethnicities, including, for instance, the Pfizer vaccine had 26% of Latinx Hispanic origin, 9.8, so almost 10% African American heritage, and 4.4% Asian in the participants of the trial, which encompassed about 44,000 people, so quite a lot of people. And to your question with regard to high blood pressure, that was not filtered out, unfortunately. However, diabetes was one of the recorded, and in the Pfizer trial, 8.4% of all participants had diabetes, and a large percentage, 35% of them, of the participants were quite overweight, and 21% had at least one other condition. And there was a lot of high blood pressure under these other conditions. In the Moderna vaccine trial, quite similar, there were 20.5% Latinx and Hispanic participants, and 10.2% African American, and 4.6% Asian. And they differentiated even more with 0.8% American Indian or Alaska Native, 0.2% Native Hawaiian or Pacific Islander, and 2.1% multiracial participants. And they had a diabetes precedence of 9.5% of the people had diabetes. And they also did not differentiate between hypertension.
Thank you, doctor.
I would like to now introduce Alex Galangan, President of the Filipino Seniors Association of Santa Maria Valley and the Acting President of the Filipino American Association of Santa Maria Valley.
Good evening. What is the vaccine made of? Does it contain the virus?
That's a really good question. The two vaccines that we have right now are both not containing any virus. They are containing a small piece of genetic code like DNA, but in this case it's RNA. And that, when our human body gets the information to make antibodies against this virus. So we do not get infected with any other virus when we get this particular vaccine.
Thank you. I would now like to introduce Marta Jimenez, promotora of the Santa Barbara County.
Hi, good evening, everyone. My question is the following. What are the side effects that these vaccines can present? Yes, it's very important that the side effects
injection site can happen, or a headache that usually lasts not longer than 2 days, sometimes chills or a slight fever. And these are all signs that the immune system gets triggered by this vaccine. And it's very comparable to other vaccines that we give. Now, in very rare cases, but that is really rare, like 10 or 11 times in 1 million vaccines, a person can get a very severe allergic reaction. But that is easily treatable, and that is why everybody who gets the vaccine has to stay at the vaccine clinic for at least 15 minutes to make sure they do not have this really severe allergic reaction.
I would like to introduce now Esron Gates, partner at Wealth Management Strategies, Area Director of District 33E3, President of Unity Speakeasy Toastmasters, and Associate with Healing Justice.
Thank you, Dr. Medina, for that introduction. Good evening, everyone. First question, what's the percentage of the vaccine's efficacy and the percentage people won't have the virus again?
Yeah, the trial data for the Pfizer vaccine showed that the efficacy of not getting severe COVID or having to be hospitalized or die was extremely high at 95% of the people who got the vaccine in the trial. For the Moderna vaccine, it was almost the same at 94%. Interestingly, the people of Latinx ethnicity had a better response in the Moderna trial than other ethnicities, just as a side note. Now, having said that, this is just in the trial when these vaccines were tested. Only giving them for a while and seeing in real life what happens, how many people still can get COVID after the fact, will be really well informed in about 6 months to a year how well they really protect us in real life. But the outlook is really bright. We're really fortunate that they work this well.
Thank you, Doctor. I would now like to introduce Dalia Garcia, manager of the Tequio Group with the Mixteco Indigenous Community Organizing Project, MICOM.
As an Indigenous immigrant woman, discrimination is always something that we have to face day by day in any institutions. Medical institutions are no different. Discrimination and lack of its accessibility to the Indigenous community is something that prevails today. So in these delicate times, how are you going to make sure that the vaccination is going to be equally accessible and provide to the most vulnerable in our communities? In your opinion, what are the key steps that will ensure success in this regard?
I can take that question. Thank you, Dalia, for the question. You know, I think that health inequities have existed, and now during the pandemic, we are seeing more health inequities than we have ever before. The pandemic has really brought to the surface all the structural inequities that exist. So with regards to what public health can do about it, we are working with our providers and our community service providers, as well as our community partners, to make sure that the most vulnerable members of our community, which includes Indigenous immigrant women, can get equitable access to vaccines. We have allocated vaccines to community providers and to the pharmacies in communities with experience working with community members. Based upon our success in and experience in other health efforts, we will create vaccine clinics in places where it's safe, in a culturally and linguistic appropriate space, and where it's convenient with regards to time, days, in our under-resourced communities. And so what this means is that we will work together, we will continue to work together with our community and partners to make sure that vaccine clinics will happen in neighborhoods, in community centers, and in workplaces in a safe and, again, at a convenient time.
Thank you, Dr. Do Reynoso. Next, we have a question by Alex Calangan.
Thank you, Dr. Medina. How can I have access to the vaccine?
As Dr. Do Reynoso mentioned earlier, many of you are hearing in the news and through other means that vaccine supply is still very limited throughout the nation, the state, and locally. Additionally, although the California Department of Public Health has just announced the two big initiatives that Dr. Do Reynoso just shared, one of which the transition of vaccine allocation moving from the local public health department to Blue Shield, who will now assume responsibility for allocating vaccine. Although we don't know a whole lot about it, we do not have all the details. We do know that we will be serving as an advisory to Blue Shield to ensure that our community is receiving access and available vaccine. Also offering vaccines are many of our community health partners throughout the county that include federally qualified health centers, hospitals, and our private medical providers. So for information on vaccine sites or eligibilities, community members can reach out to any of the following. You can call 211. You can follow us on social media, Facebook, Instagram, Twitter. You can also visit us at our public health website, which is publichealthsbc.org. or join us and listen in on our weekly press conferences. So with regards to the two initiatives related to COVID vaccines, aside from the third-party administrator new allocation framework, there is also a new registration or scheduling platform that is being rolled out, and that is called My Turn. Lots of you may have been hearing about that new platform. My Turn is where you can find out if this is your turn to get vaccinated to schedule your appointments. You can learn more about My Turn at myturn.ca.gov, or again, you may visit our website. We at the Santa Barbara County Public Health Department, we are in the midst of transitioning our appointment scheduling to My Turn. Thank you.
Doctor, and thank you, Alex, for the question. I would like to invite now Eshron Gates.
Thank you, Dr. Medina. I have heard numerous reports and personal experiences of people dying after receiving the COVID-19 vaccine. Why should I, as a Black and brown person, get the COVID-19 vaccine?
I'd like to begin by saying that COVID-19 is not an equal opportunity killer. Black, Latinx, and Indigenous people are getting the disease more often and suffering more severe outcomes than white Americans. There's nothing about being Black, Latino, or Indigenous in and of itself that makes people more susceptible to COVID. Instead, it is social determinants of health and other disparities that these populations face that contribute to why they are disproportionately impacted by COVID-19. For example, housing. Low-income families often live in dense housing quarters, making it impossible for them to safely or adequately isolate or quarantine, hence increasing transmission of COVID-19. Additionally, it is important to recognize that communities of color are disproportionately affected by other chronic medical conditions such as diabetes and hypertension, which further predisposes them to more serious COVID-19 outcomes. Because of these reasons, we in Santa Barbara County have been focused on looking at our COVID-19 response activities from a health equity lens and ensuring that everything from education, testing, and now vaccinations are offered equally and accessed throughout our communities.
Sí, mi siguiente pregunta
Hi,
es,
the following question is, how will we be able to obtain the vaccine when we don't have Medicare or any other type of private or job-related insurance?
I can answer that question. Thank you, Martha, for your question. The vaccine is completely free of charge. None of the vaccination sites will ask you to pay for the vaccine. Also, it is not necessary for you or any community members to have Medi-Cal or private healthcare insurance or work-related insurance. So again, the vaccine is completely free to anyone in our community who wants one when they are eligible.
Gracias, Marta. Thank you, Dr. Del Reynoso. I would like to now call on Dalia Garcia for the question you have.
Sí.
Yeah, hi. I'm going to share an experience of a Mixtec colleague here in Santa Maria. He received the vaccine in the Alberton market here. And the first thing that he was asked, the last 4 digits of his social security number and an insurance. So well, fortunately for him, he didn't have any problems with this. But the question is, why are those that are giving the vaccine asking for the social number and insurance? Also, and these types of questions and attitudes scare our community, and it doesn't allow them to have comfort or trust to get the vaccine. Thank you.
Yes, I am bothered. I'm saddened by the experience that Mixteco community member experienced. I will address it with our partner to ensure that moving forward, it doesn't happen again, not only at that site, but other sites as well. I can tell you that your social security information is not a part of the registration process, and you should not have to give your social security information. And I can see how being asked that could be very threatening and could be very, could prove to be a barrier to other community members coming forth and get vaccine. So we will address that. And with regards to the insurance, again, the insurance is not a requirement for the vaccine. So thank you for sharing that experience. We will ensure that that will not happen moving forward.
Thank you, doctor.
Gracias, Dalia, y gracias, doctora Reynoso.
Thank you, Dalia, and thank you, Dr. Del Reynoso.
Sean Gates.
Thank you, Dr. Medina. Last question. Is there any data or statistics that show minority groups receive the same treatment as the majority groups, specifically in terms of access to breathing treatments or BAM?
I can take that one. So let me begin by saying BAM is short for the generic name of the antibody therapy available to treat mild to moderate COVID-19 in adult and pediatric populations. It is authorized for patients with positive COVID-19 results who are 12 years of age and older and who must weigh at least 88 pounds and who are also at risk for progressing to severe COVID-19 and or hospitalization. BAM is not authorized for patients who are hospitalized due to COVID-19 or who require oxygen therapy due to COVID-19. Since November, Santa Barbara County has received 677 vials of BAM, which have been distributed to local hospitals based on an allocation matrix that assures equal distribution to our hospitals. This allocation involves evaluating emergency department COVID-19 positive numbers, not hospitalization numbers, as it is not authorized for hospitalized patients. In terms of answering whether minority groups are receiving the same treatment as majority groups, we do not have this data at this time, but we can certainly research this for further analysis. We can, again, say at a minimum that each of our hospitals throughout the county has received BAM allocations based on a percentage of positive COVID-19 cases in emergency rooms.
Thank you, Ashran. Thank you, doctor. If Marta Jimenez could share her question next.
My third question is the following. Does the vaccine or the vaccines that have been mentioned, Pfizer and Moderna, are they differently, or do they work differently because they come from different labs?
Yes, I take that question. Thank you, Martha. The two vaccines that we right now have, one from Pfizer and the other one from Moderna, they work exactly the same. They are very, very similar. They don't have any virus, and they have this little bit of genetic material in them. They were just produced by different companies, and but they work in the same way. We are anxiously awaiting for a third vaccine to come on the market. It is currently in the approval process with the FDA, and we hope that it will be approved in a matter of 10 days. And that is by the company Johnson & Johnson. So we don't have that yet. That one will be easier in that it will only require one shot. And it will work slightly differently because they use sort of like a killed virus that can only carry a little bit of this genetic code into the body. This virus is not capable to make anybody sick. It's just like a car that drives into the garage of the cell in the human body, basically, when it gets injected to get this information in there so that the body makes the antibodies to fight the real virus. So we are looking forward to getting this third vaccine, which will work slightly differently, but it has the advantage that it just only needs one shot. That's what's on the horizon.
Gracias.
Thank
Gracias,
you.
Marta. Gracias, doctor.
Thank you, Martha. Thank you, doctor.
Thank you to our community partners for the questions that you have brought forth. We have some questions we're receiving from the community, and they are, one is, what are the long-term effects of the vaccine?
Yeah, I can speak to that. As you can imagine, these vaccines are brand new. The first time that the Pfizer vaccine was actually, or the Moderna vaccine started earlier, was 1 year ago that the first human beings got the vaccine in the test period from the company. And so that is the longest that anybody has had the vaccine. And as of now, we do not know of any long-term effects. Now, once these vaccines are given all over the world to many, many millions and soon billions of people, we will learn more and more about this. But as of right now, we do not have any inclination that there are any significant, or any, for that matter, long-term effects, negative effects from the vaccine.
Thank you. Our next question is, who in the population will be able to safely get the doses?
Yeah, I think I take that question. So right now, one of the vaccines, the Pfizer vaccine, is approved for people 16 years and older. And the only people who absolutely cannot have the vaccine are people who have a severe allergy to some component in the vaccine, which is it's called polyethylene glycol. It's actually used when somebody drinks it before a colonoscopy. It is also used in dermal filler products that get injected. So there are some people who have severe allergic reactions to this polyethylene glycol, and they must not get the vaccine. Also, if somebody after the first shot gets a very strong allergic reaction, they must not have the second shot. It's absolutely contraindicated. So those are the two main reasons that somebody should not have the vaccine. If somebody is pregnant or has a disease like cancer or a disease where they have to take medicine to suppress the immune system, it is not contraindicated, but I would strongly recommend they discuss it with their doctor who knows them best if they would benefit, if the benefits for them to getting the vaccine are more than the risks. But so far it is pretty safe.
Thank you, Dr. Answer. Let's see. Another question we have is who will not be able to get the vaccine and what should they do?
I think I just answered that question probably because, people who had a severe reaction after the first shot, they cannot get one. But on the bright side, the one shot gives them already good protection. So it's, but they shouldn't get a second shot. No. And everybody who comes for a vaccine gets asked all these questions. We screen every single person who comes to a vaccination clinic and ask them all these questions to make sure we don't cause any harm. In addition, we have paramedics and firefighters at the end of after you have received the shot that observe you for 15 to 20 minutes. You're not allowed to leave the clinic. You get observed just to make sure you don't have a bad reaction right after.
Thank you. And it looks like we have time for one more question. Is that correct? Okay. Who do I contact if something goes wrong with the vaccine?
I'll take that one. So if someone should have a severe allergic reaction after getting vaccinated, it is important that they report it to the vaccination provider, because the vaccination provider is responsible for submitting what we call a VAERS report. It is VAERS standing for Vaccine Adverse Event Reporting System. And this is a national system that collects reports about adverse events. So this is how we can study anybody who's having any reaction. And although Dr. Onsorg has already mentioned that severe reactions are rare, anyone experiencing difficulty breathing or any severe reaction should seek medical care immediately. I also want to remind everybody that when you do receive your COVID-19 vaccine, there is a smartphone-based tool called vSafe, and we encourage you to participate in using that. Through vSafe, you can quickly tell CDC about any side effects that you are receiving after getting the COVID-19 vaccine.
Thank you so much for all of you. We look forward to having more spaces like this. And I'll pass it on to Jackie now.
Thank you so much to our community leaders who asked these really important questions tonight, to Dr. Medina for her efforts to ensure inclusive dialogue, and of course to our public health panelists for their time and energy in protecting our community's health. We truly thank all of you. This isn't the end of this conversation, but rather a step towards ensuring equitable access to information for our many communities. Questions not answered in this space will be available in the next few days on the public health website and through community partners. Additionally, we will be sharing a survey with all of you to continue informing equitable COVID-19 outreach efforts. With that, I'll turn it over to Dr. Del Reynoso for closing remarks.
Thank you, Jackie. I want to say thank you for all of you for being with us tonight. We acknowledge that the communities represented today, along with several others, have been historically under-resourced. And we intend to change that. This town hall forum is just the beginning of a conversation and just one more step towards our mission in promoting health equity. And what this means is that we will continue to make sure that testing, isolation and quarantine, supportive services, and now the vaccine will be available to all members of our community. We hope to maintain partnerships with the communities and work together to remove barriers such as lack of information, distribution efforts, and access to the vaccine. We are committed to ensuring transparency across all of our vaccine efforts with the weekly updates to our Board of Supervisors, at our press conferences, and updates at the bi-weekly Latinx and Indigenous Migrant COVID-19 Task Force on Fridays. And also, please check out our website, which contains data and information and refresh on a daily basis. And that is publichealthsbc.com. My heartfelt thanks to the following individuals and teams for making this evening possible. I appreciate your imagination, your passion, your time, and most of all, your trust in this effort. I'd like to say thanks to the Latinx and Indigenous Migrant COVID-19 Response Task Force, community members and leaders and ambassadors, CAUSE, MyCop, ILRC for your translation, the translation team, the technical support team, the Santa Barbara County staff, and the Santa Barbara County Public Health Department staff, and everyone tuning in. And lastly, I'd like to appreciate all Santa Barbara County residents for your continued unity in combating COVID-19 by wearing your mask, by maintaining your social distance, and limiting your gatherings. Thank you, good night, take care, and please be safe.